Thank you, Pan Masters, for that wonderful opening. We will be hearing their fabulous sound throughout the program. Can't wait. Good evening and welcome, everyone. We are so honored that you are joining us tonight, and we hope that you will have a ton of fun while learning about Carindale Foundation and the many ways that you can help us serve. We will have a couple of giveaways throughout the evening, but you have to be present to win. So now let's get started. And please welcome Carindale Foundation's founder, Ms. Allison Burkett.
Good evening, everyone. It is with great pleasure that I'm here with all of you celebrating the 3rd anniversary of the Carindale Foundation. These 3 years have been both rewarding and challenging, especially as we navigated the COVID-19 pandemic and figured out how to continue to move our mission and vision forward. The fact that the Carindale Foundation has been in existence for 3 years also means that it has been 4 years since my sister passed away. Her passing is still a heavy loss for our family, but we continue to step forward in faith and honor her memory every chance that we get. My heart is filled with gratitude. Gratitude for our board members, all of whom have been by my side from the founding of this organization. Gratitude for our donors, who have been supportive and generous with their contributions. Gratitude for our partner organizations as we work towards our shared vision of making an impact in our communities. Without all of you, none of this would be possible, and we would not be here today. So from the bottom of my heart, I thank you. I thank you for providing me with the opportunity to continue to honor the memory of my sister through the Carindale Foundation. Now let's take a look at what we've accomplished in the last 3 years. Thank you to everyone who made all of these accomplishments possible. I would like to recognize the Queen City Rotary Club, who was our partner in our very first project, providing books to all third graders at a Title I school in the Charlotte area. I would also like to recognize the Rotary Club of Ocho Rios in Ocho Rios, Jamaica, and their past president, Anne-Marie Bishop, who were instrumental in our first international project. This was our COVID-19 response project, and at that time, we were not able to travel to Jamaica. Under the leadership of Anne-Marie, the club managed the logistics for the procurement of the medical supplies that we donated to the St. Anne's Bay Regional Hospital in Jamaica, and they also coordinated the handover to the hospital. Special thanks to both of these organizations. Now let's hear from some of our beneficiaries and partners.
My name is Dennis Morgan, CEO of the St. Anne's Bay Regional Hospital, and I want to take this opportunity to highlight and to say thanks to the Carindale Foundation for their support and generosity. As you all know, last year, Jamaica, as well as other countries in the world, were struck by COVID-19, and hospitals were stretched for resources. Our hospital in particular was in need of a number of medical equipment to equip our frontline workers to fight deadly virus. We reached out to the Carindale Foundation, and without hesitation, they came through for us in a big way. They provided us with gloves, masks, shoe covering, and a host of other vital equipment for this fight, and they continue to do so. Recently, we reached out to them again for some additional equipment, and they provided funding to the tune of 800,000 Jamaican dollars for us to acquire those equipment so that our frontline workers can do their job in protecting and keeping Jamaicans safe against this deadly disease. Carindale Foundation, from the bottom of my heart and on behalf of a grateful staff, and I dare say a grateful nation, we thank you for your generosity. We thank you for your support. I also want to thank the donors of the Carindale Foundation, because without your generosity, the Carindale Foundation and similarly situated organization would not be able to meet the request of entities such as ours. And for that, we are truly indebted to you. We thank you for supporting the Carindale Foundation, and by extension, supporting us, our frontline workers, so that we can keep the Jamaican people safe while providing them with the top quality healthcare that they have come to expect. Thank you so much. Thank you, thank you, thank you.
Good evening, everyone. I am Mylene Matthews Benzano, the president of the Caribbean International Cultural Association, also known as CICA. For the past 22 years, CICA has lived up to its mission statement, united in service to the Charlotte community and the Caribbean community worldwide. We do this in a variety of ways. We provide assistance to local and international disaster relief efforts, most recently during the eruption of the volcano in St. Vincent and the Grenadines in April 2021. Each year, during the Thanksgiving and Christmas holidays, we provide monetary contributions in the form of gift cards to retail, restaurants, and grocery stores to purchase gifts and meals for families who have children receiving treatment from the Levine Children's Hospital in Charlotte, North Carolina. Awarding scholarships annually to high school graduating seniors of Caribbean descent. This is our main goal. To date, we have awarded more than $50,000 to 66 recipients. Seeker is extremely fortunate in fostering relationships with multiple repeat donors to our scholarship program. One such donor is the Carindale Foundation. The Carindale Foundation developed a partnership with Seeker in 2020 to award an additional scholarship to students whose major was in the medical field. During our annual award ceremony, Alison Burkett, the president of Carindale Foundation, presented 3 of our recipients an additional award in the amount of $500 each. In 2021, a single recipient was the benefactor of that award in the amount of $1,500. We take immense pride in assisting our young generation in their quest to make a positive impact in the world. Now more than ever, during the COVID-19 pandemic, we need more medical professionals. Our lives truly depend on it. Not only did we gain a great partnership with the Carindale Foundation, we welcome Alison as a member of the Seeker family. We are extremely grateful and proud to be associated with Alison and the Carindale Foundation and look forward to future endeavors. On behalf of the Caribbean International Cultural Association and myself, we wish Alison and the Carindale Foundation great success in its mission. May God continue to bless all of us and keep us safe. Thank you and enjoy the evening.
Good day, everyone. My name is Jadine Thomas, and I am one of the guidance counselors at the St. Anne's Bay Primary School. We are immensely grateful that our students were selected as beneficiaries of the Carindale Foundation. Through your generosity, over 100 students benefited from tablets and data plans. This enabled them to attend classes, complete assignments, and even sit examinations. These students are from varying socioeconomic backgrounds and communities. Some of them were even facing financial constraints prior to the onset of the pandemic, whereas others faced challenging circumstances when their parents lost jobs due to the effects of the pandemic. Words are inadequate to truly express the gratitude that we feel for your decision to invest in the education of our children. It is with your help that we're now able to hope for a brighter future for many of our students. Thank you.
Good afternoon. My name is Canada Graham. I'm from St. Anne's Bay Primary School. I appreciate your help for giving me the phone card that I could put on service on my device to do my classwork and my homework. Thanks for your support. It has been a very big help in times of need. For that, I am grateful. Thanks again.
During the 2021 academic year, we grapple with the unprecedented effects of COVID-19. Teaching and learning during the repeated school closures was challenging and has had a huge impact on the continuity of children's education. Our school, St. Anne's Bay Primary, like others, was impacted by the varying factors, including but not limited to students' absenteeism, internet interruptions, and inadequate resources such as tablets, laptops for students' use. Today, we are grateful and indebted to the Carindale Foundation, who understood the challenges, saw the need to help, and came on board and provided 40 Lenovo tablets, in addition to cash to purchase data plans for our students. The gift was timely. The expression of joy on our students' faces upon receipt of their tablets is forever etched in my mind. The delight was inspiring and at the same time humbling. Through this partnership with Alison and the Carindale Foundation, we were able to change the educational trajectory of these 40 students by giving them hope for a brighter future and for providing them with the tools needed to access and benefit from quality education. The beneficiaries of this initiative were now able to access classes and benefit from that all-important teacher-pupil interaction. They were able to complete and submit their assignments and to review their teachers' feedback. What a change. St. Anne's Bay Primary could not have done this without you, Carindale Foundation. Words will never be enough to sufficiently express our appreciation and gratitude. But please note that your acts of kindness will always be remembered. In my capacity as principal, I speak on behalf of a grateful school and all beneficiaries in saying thank you and may God continue to bless you.
So now you have seen and heard about the many ways that KDF has helped, but there is still lots to be done, and we want you to know that we cannot do it without your support. Some of you have already donated tonight, and we are so grateful. Thank you. In the chat box, you will find links to the ways that you can give tonight. It's super easy. And before we go to our intermission, we have our first giveaway just right after it. And I wanted to give you a hint. Have your chat box ready. Welcome back, Pan Masters. I can't get enough of that music. I love it. Okay, so ready for our first giveaway. The giveaway is for a $25 Amazon gift card. Please answer the following question in the chat box. Ready? On what date was KDF founded? Looks like we have a winner. Rodney Brown. Congratulations. We will make sure that you get your $25 Amazon gift card. So thank you. There is more giveaways coming. There's actually one more giveaway coming up. So stay tuned. We will continue on with the program.
Thank you, thank you, thank you.
Thank you.
Thank you.
Thank you.
Thank you to all of our donors and sponsors who have supported us from the very beginning and throughout the last 3 years.
Hi, my name is Rodney Brown, and I am Karen, or as I know her, Dale's younger cousin. Growing up, Dale was my kind, gentle, smart cousin, the cousin that I looked up to, the cousin that I wanted to be like. And I cherished her as my big cousin, as part of my family, as someone that I wanted to be. And this kind, gentle, and smart cousin, when she needed me, when she could have used my help, I wasn't there to help her. I participate in the Karen Dale Foundation to make sure that no other families need to go through what this family went through, to help contribute, to make sure that people in Jamaica have access to the tools they need to maintain their health, that they have the tools that they need to get the education that they so desperately deserve, and to make sure that we continue to honor Dale. So I participate and contribute in the Karen Dale Foundation to continue to support and honor my gentle, my kind, my smart big cousin, Karen Dale Burkett.
Hello, my name is Jolene, and I have been supporting KDF since its inception 3 years ago. And I continue to support the organization because I believe in the mission, but also because of two other reasons. One is the transparency. I like the fact that I get periodic email about what is going on, or I see through their social media posts how they impacted the community, in whether in Jamaica or scholarships that they have given in the Charlotte community. The other reason is I like that they are working with the organizations and not just imposing what they think, the local community in Jamaica needs. I remember when Allison took a trip to Jamaica and she spent time talking to the executives at the hospital, or the virtual meetings she's had with the Rotary clubs in the area, again, to find out what the community needs and not just what she thinks they need. So congratulations to the board for an amazing job the last 3 years, and I will continue to support the organization as best as I can in the next few years. Congrats.
Thank you again, supporters. We have created a simple way for others to join them in supporting the Karen Dale Foundation. This is the KD48 Circle. The KD48 Circle is simply a circle of support for the Karen Dale Foundation. It is a group of people who have made a commitment to support KDF's mission and vision. KD represents Karen Dale's initials, and 48 is the age at which she passed away. The goal of this fundraising program is for us to have 480 members who have made a commitment to donate at least $48 per year to the foundation. This will allow us to consistently raise over $23,000 per year, 100% of which will be used to support KDF's programs and projects. In terms of impact, this will allow us to increase the amount of medical equipment and supplies we provide to the public hospitals and medical facilities in underserved communities in the Caribbean, increase the amount of our scholarship awards, make a difference in the lives of more children through our education and literacy program, and provide access to medical specialists through telehealth services as part of our Carry Health initiative. Thank you to the current members of the KD48 Circle, and we hope others will join them so that we can continue to increase our impact in the Caribbean and local communities.
Thank you, Allison. So if you are a member of the KD48 Circle, we thank you for your support. If not, I'll ask you, please think about becoming a member. It's only $40 a year or more if you want to. For $48 per year, that's less than $4 a week. So we'll appreciate your support to help us keep doing what we're doing currently and hopefully doing more. And of course, no gala is complete without a keynote speaker. And this evening I have the privilege to introduce or say a few words about our featured speaker for the night. Her name is Dr. Kijana Nix. Dr. Nix is a general pediatrician and hospitalist who is board certified by the American Board of Pediatrics. She is licensed to practice medicine in Washington, D.C., Maryland, Virginia, Georgia, Antigua and Barbuda for medical missions, Trinidad and Tobago, and Jamaica. Dr. Nix is originally from Jamaica and attended the University of the West Indies Faculty of Medical Sciences, Mono Campus, in Kingston, Jamaica. She completed pediatric residency training in Washington, D.C. at Howard University Hospital and Children's National Medical Center. She is an adjunct assistant professor of pediatrics at Howard University College of Medicine and works as a newborn hospitalist attending at Howard University Hospital. Dr. Nix is the founder of Nix Direct Access Pediatrics, a general pediatrics consultation company. She is also the co-founder of Trusted Medical Services LLC, a new pediatric and holistic wellness practice now serving patients in the Washington, D.C. metro area. Dr. Nix is a fellow of the American Academy of Pediatrics, a member of the Academy of Breastfeeding Medicine, the American Telemedicine Association, and the International Society of Telemedicine and E-Health. She is also a member of a mainly female and minority-owned telemedicine company called Reliable Online Wellness Experience, better known as Road Doctors. Dr. Nix is a recipient of several awards, including the 2015 American Academy of Pediatrics Award that recognizes Academy Fellows who are committed to continuing professional development in pediatric medicine. She was recently recognized by the Mayor of Washington, D.C. for outstanding public service as a frontline hero during a global pandemic. Dr. Nix has also received other awards and certificates a recognition of her involvement in volunteerism and philanthropy. She is also the co-author of an Amazon bestseller, Navigating Triple Pandemic: Healthcare Workers of Color Confront Racism in America, Health Disparities, and the Trauma of COVID-19. Dr. Nix is a strong believer in giving back to the local and international community, and has always believed that her purpose in life and in the field of medicine is to make people healthy and happy. Outside the rigors of her professional responsibilities, Dr. Nix is invested in international missionary work and has traveled to different countries to provide free health care to patients, including Antigua, Haiti, Jamaica, St. Vincent and the Grenadines, and Kenya. Dr. Nix is a lover of life and enjoys traveling, photography, and exercising her culinary skills. She sees the importance of fitness through dance and the need to keep moving, and became certified to teach Zumba. She is also the co-host of Caribbean Nation Health, a Caribbean-based TV show that is on YouTube and also airs in 22 Caribbean countries, United States, Canada, and Europe. In addition, she has been the repeat guest on Health Talk, a feature of the Caribbean Exchange radio show on WEAA FM 88.9. Ladies and gentlemen, please welcome Dr. Nix. Dr. Nix, you have the floor.
Thank you so much. Thank you. Thank you. I can't believe I've done all of that. That doesn't sound like me at all. But good evening, everyone. A very warm and vibrant Jamaican greeting. I say Jamaican because I'm from Jamaica. Jamaican greeting to the board members of the Carindale Foundation, their supporters, and esteemed guests. If you're watching this delayed recording, greetings to you as well. Thank you for the support you have given to this organization over the years. I would like for us to pause for a moment to reflect on our blessings and think of our loved ones who are no longer with us due to the COVID-19 pandemic or for other reasons. So just a moment of silence, please. What a year 2020 was, and what a year 2021 has been so far. I remember on January 1st in 2020, I found an interesting picture that I took during one of my overseas trips. It was a perfect picture for creating a meme that I titled 2020 Vision. This is because it reminded me of the picture of a highway with a ball in the middle that you are instructed to stare at when you go to the ophthalmologist office for an eye exam. We all thought 2020 was going to be a year like no other. We were looking forward to a lot of positive things, getting ready for weddings, vacations, and milestone celebrations. I was looking forward to traveling to the motherland for my usual medical mission trips and other celebrations, but the year of perfect vision did not happen, or did it? Little did we know that we would have been faced with a deadly pandemic, and up until this day, we're still experiencing heartaches, pain, job losses, loss of homes, evictions, severe illnesses, death of our loved ones, and other life-altering experiences. The year 2020 saw our healthcare system struggling due to the lack of PPE and other critical resources. A developed country like the USA was not even spared. The lack of PPE is an everyday thing in the Caribbean. I want you to remember that. But the pandemic created a more dire situation for their healthcare workers. It revealed their plight, and they continue to suffer from lack of resources. There are existing organizations as of today that focus on fundraising efforts specifically to buy PPE for our healthcare workers. Even medical students and nursing students are also included. Grenada and Jamaica have such programs where you can now donate money to help with providing PPE. Health disparities continue to be a major concern, and racism also became clearer, especially with the death of George Floyd. In effect, we were faced with, and still we're facing, a triple pandemic. We're almost done with 2021, and we're still experiencing arguably worst healthcare crisis of our lifetime. So, was 2020 the year where the Band-Aid came off and the mask was on? We are living in a time of unpredictability and sometimes absurdity. These are indeed unprecedented times. People are still struggling. We continue to live in fear and are still feeling an air of uncertainty while some of us are still grieving. Everyone has been affected, no matter where you are in life, whether you are rich, poor, or in between, whether you are healthy or unhealthy. We are all still at risk of being affected, whether it's due to COVID-19 disease or economic burdens. Gladly, vaccines are available and we have the opportunity to mitigate the spread of this dreaded virus. As we sit here in attendance at this virtual gala, I would like for us to think about the people who are not in the position to participate in an event like this. I'd also like for us to consider the people with little or no access to healthcare, the children with barriers to having basic education, and people who are unable to find a little something to eat, or even something as basic as water to drink. As a physician, member of medical mission teams to underserved areas in developing countries in Africa and the Caribbean regions, I have witnessed our fellow brothers and sisters experiencing desperate and harsh living situations. Fortunately, we have organizations like the Carindale Foundation that has been supporting ongoing health and education projects even before or during this pandemic. So what is a medically underserved area? A medically underserved area and medically underserved populations are geographic areas and populations with a lack of access to primary services. Example, rural parts of America and some of the most remote areas of this world located in the Caribbean, the Pacific, and different regions in Central and South America. And what is a developing country? A developing country is defined as a country with less developed industrial base. In general, it's a country that is not developed economically and socially. It's a country where the gross national income is usually lower. United States, United Kingdom, Canada are examples of developed countries, while Jamaica, Haiti, Kenya, and other countries in the Caribbean region, Central America and Africa are examples of developing countries. The main interrelated challenges common to developing countries are the lack of access to basic amenities such as food and water. This can lead to diseases, and just imagine the danger with little or no access to healthcare. And just imagine in these countries having little or no access to basic education, not necessarily because the schools are not present in some areas, but because of affordability. How is a hungry child going to have the energy to go to school? When the child gets to the classroom, how is the child going to learn and focus? How are countries going to have a healthy nation without educated people and a thriving economy if the children are not learning? This is why we have to continue to do our part and meet the sacrifice if we can. I am very grateful that I've had the opportunity to learn as I serve the children in some of these areas. I have so many stories I could share with you, but there's one I'm going to share with you tonight that has never left me. I remember I was in rural Kenya, Lilo village, when a group of boys brought in a young man with decreased level of consciousness. Now, I had no access to hospital or emergency equipment, but I was able to stabilize him. And I knew he had to go to the emergency room. So I found a bike, got a bike, someone called a bike. I said, this kid has to go. And I found 100 shillings in my pocket and I paid for this young man to go to the hospital. And the interesting thing is he was tucked between two men to keep him upright. There was no ambulance. And imagine there was a language barrier. So the very interesting thing is, so he was diagnosed with a seizure disorder and he was out of his medication. So he recovered. The next day, this little angel came to see me. Oh my goodness, my heart just basically melted. Before he left, I literally gave him because sometimes we take supplies there. We gave him school supplies. I packed his bag with sweetie, as we call it, candy in America. I mean, I gave him all that I could, So it's very important for us to really support initiatives like this, and because you can help to make a difference. You can help to make a difference with donations of supplies, to hospitals, clinics, and schools, like the Carindale Foundation does. Lately, though, healthcare has gone through drastic changes because of the pandemic. It really needed a lifeline to stay healthy, especially in these challenging times. Fortunately, science, technology, and medical innovation gave us the tools we needed to minimize these gaps in healthcare. In 2014, I became a member of a telemedicine company comprised of mainly female physicians. We thought telemedicine would have been a game changer back then, but unfortunately, it appeared that the idea was not even taken seriously. We knew that it had a role in healthcare. Interestingly, it was challenging getting people to understand what it was about. Unfortunately, it took the pandemic for the industry and its players to realize that this should have been a part of the equation regarding patient care all along. Who knows why this idea was not well received back then? The pandemic made us realize that telemedicine is a necessity. In Jamaica, we have a saying that goes like this: when trouble take you, the shot fit you. We had to quickly adjust to the virtual world, and telemedicine was finally at the forefront when face-to-face visits were risky for not only our patients, but also healthcare workers. From your doctor's offices to the hospitals, from their doctor's offices to the hospital, virtual visits are still being conducted with thousands of visits per day. When trouble take you, pick the shot fit you. For those who don't understand, it means when you're in trouble, you find ways to do the unthinkable or the impossible, or you just find yourself doing something that you never thought you would have been capable of. The Jamaican patois word, by the way, for those who don't know, means child. It means child. We quickly found a solution to see patients, so telemedicine became popular. There was an article recently that I read in Health IT News. It was shared by the American Telemedicine Association in August of this year, titled, "The Biden Administration Invests Nearly $11 million Towards Pediatric Telehealth. This funding is intended to broaden access to behavioral health care for children." As a pediatrician, I'm absolutely thrilled about this report. Yes, in all of these muddy waters, there's positive news in the healthcare industry. Now, we have more funding to reach children where they are. Children's overall mental wellness is important for the development of our future generations. But what about the children in the rest of the world? Developing countries are not considered in this investment, so this is why we have to support foundations like this to help with screening for behavioral and other healthcare problems. So, just in case you don't know what telemedicine is, it is the delivery of healthcare services where distance is a critical issue. This is done by healthcare professionals using information and communication technologies for diagnosis, treatment, and prevention of diseases and injuries. What are some of the barriers? So basically, the requirement for developing countries is somewhat more demanding than that for a developed country. Limitations may exist due to social, organizational, political, and technical aspects that need to be considered for it to be successful. From a technological standpoint, the lack of access to reliable internet and telephone services and the absence of a proper user-friendly interface can also lead to delay in care. While telemedicine is convenient, this is one advantage. It can also be used to monitor patients with chronic medical problems remotely. We have seen where patients and physicians are satisfied. It encourages local healthcare workers to remain in rural areas because now there is professional support. Continuing medical education conferences and courses can be offered by telehealth services. People no longer have to leave their villages to travel hundreds of miles because now they can be treated in their local communities with the aid of a telepresenter. It can reduce the unnecessary transport of patients to major cities. There are some disadvantages though. But one such disadvantage is the reluctance for a patient to go to an in-person face-to-face visit when it's absolutely necessary. And sometimes critical findings can be missed on a patient that could have been observed by the doctor during an in-office visit. That's another disadvantage. So what are some of the applications? Telemedicine has so many applications. Patients can now consult their doctors if they need medical advice for most non-emergent, non-urgent medical conditions. Just imagine that you can treat a patient with a simple medical concern before it becomes complicated. It can be used to educate and take care of the simple things before they become a burden to the patient, their families, and communities. Health literacy is also vital. It's vital for survival. Providing general health education measures like smoking cessation, asthma education, and just general teaching of the patient. And also telemedicine can also help with that. The future of telemedicine is already here. Are we now ready to embrace medical admissions via telemedicine? Can we now volunteer from a distance? Well, infrastructure has to be in place. Providing populations in underserved countries with the means to access to healthcare has the potential to help meet previously unmet needs. We can remotely help to diagnose and treat more patients globally with the help of nurses, local community healthcare workers, or families using strategically placed equipment. We can use kiosks, laptops, tablets, or cell phones designated for telemedicine use only. These can be placed in certain locations in underserved areas. We can also provide care through the school-based system. During the pandemic, we have seen the progress with technology. There is and continues to be growing development of internet-based conferencing and educational webinars without using expensive teleconferencing equipment. There's Zoom and Microsoft Teams, and sometimes people use WhatsApp. There is hope for developing countries, and the expansion is promising. As a member of the American Telemedicine Association and the International Society for Telemedicine and e-health for a number of years, I have noticed that telemedicine is becoming more mainstream, and membership and interest within these entities have significantly increased. This is evidenced by the numerous email notifications that I received about who is the new member, a new member organization, and so on. The International Society for Telemedicine and e-health is now represented in over 100 developed and developing countries, including nations in Africa, the Caribbean, Middle East, and South America. Telemedicine companies are present in the Caribbean, but is still not widely embraced and they're not largely known. Cross-border telemedicine is possible, but physicians have to be appropriately licensed, and having a malpractice insurance is highly recommended. So I hope telemedicine is here to stay. It is overall a useful tool for patient care and continued monitoring. It can reduce barriers. Reducing barriers to telemedicine will improve patients' access to general and specialist physicians and other healthcare professionals. It is the remote delivery of healthcare by information and communication technology to diagnose, treat, and prevent diseases. It helps to reduce travel time and cost for patients and their families, especially who are in rural and underserved areas. Medical expertise can be utilized locally and internationally. We now see that video platforms are capable of providing educational benefits for children, families, and healthcare professionals. It is costly for the lower income countries and families who cannot afford a data plan. In some situations, there may be a problem with access to areas for equipment set up, and so you have to think of the terrain of the country and general connectivity concerns. Telemedicine is an adjunct, it's not a substitute, and it cannot be used for all medical conditions. Telehealth provides opportunities for distance learning, but we have to remember that cost is a major factor, especially in low-income countries. It is good for patient care because a little care is better than no care at all. These are tough times, but we must remain optimistic. If we share with each other and work together, we can get through these harsh times. I'd like to share with you a fun fact how I became connected with the Karen Dale Foundation. It was by chance encounter on a social media platform. I saw pictures that a friend shared, and I won't call the name of the person because the person is here. You know who they are, of an organization donating to a hospital in Jamaica. So I got curious. So I looked at the website and saw healthcare and education projects. And so I contacted and left a message. And here I am today giving the keynote speech. Life was a way of granting us full circle moments. So every opportunity you have to connect with an organization like this will definitely bring you to a place to fulfill a need. Do you remember the song, No Man is an Island? We all rely on each other to survive. We have to continue to do our part to support health and education. Whenever we can, let's help someone out of poverty. Let us continue to support foundations like the Carindale Foundation so they can achieve their goals. That someone you help today could very well be helpful to a family member or even to you, or even a friend later on in life. You never know. So please continue to donate because you're supporting health and education of children in Jamaica and the Caribbean. You're also supporting scholarships locally and internationally. And when it's time, or if it's safe for you to travel and if you're comfortable traveling again, we can go to these designated areas and have face-to-face, or maybe we can have hybrid models, which is telemedicine and visit, sometimes. I encourage you today to join and support some kind of organization or group like this. And when it's safe and when you feel comfortable to travel, you can go and see where and how people live. Even if you are non-medical, you can also make a difference. It will be a life-changing experience, but believe me, you will leave empowered, inspired, and your heart will be set in the right place, a place of hope. Thank you so much for listening. Keep on donating and continue to enjoy your evening. Giving is good for your health and wellness. Thank you so much.
Thank you, Dr. Nix, and thank you so much for making sure that the person who connected you with the KDF remained anonymous. It is so true that at the beginning of 2020, we all had so many plans. And then with all the multiple challenges that arose, with COVID, like you said, and the death of George Floyd, it all hit us. And although COVID presented a challenge, telemedicine allowed opportunities to continue to provide needed medical support in lieu of the challenge for, we couldn't go into the doctor's offices. So telemedicine definitely kicked in. It's amazing. I didn't even know that telemedicine is now available in over 100 countries. So learn something new every day. Your background, your passion, your accomplishments, your volunteering of your services to all of these underdeserved countries is truly inspirational. And so thank you so much for sharing all of that with us. Now I'll hand it back over to Lorena.
Thank you, Andrea. Okay, so this is my last and final push for your help. Please consider donating tonight. You can give via PayPal, Cash App, or Venmo, or you can join our fundraising program, KD48 Circle. So if you're ready, get your chat box ready. We're going to go ahead and do the second giveaway. What is the name of our fundraising program? I don't know if you were listening to me. Yeah. Looks like we have a winner, and Ava Grace Lee. Congratulations. And Allison, I think we are ready for you.
Thank you, Lorena.
You're welcome.
We appreciate you spending the evening with us and helping us to celebrate all that we've accomplished so far. We will continue to work with our current beneficiaries and partners with the goal of continually increasing our impact in the Caribbean and local communities. My sister spent her final days at the St. Anne's-Bay Regional Hospital, and both of us were students at the St. Anne's-Bay Primary School, so we are very much connected to those two organizations. We will also work towards expanding our Carry Health initiative in the future to include a program for telehealth services and projects in other Caribbean islands. Thank you to all of you who are already on this journey with us, and we invite others to join us. We will need all the support we can get, so please spread the word and tell others about KDF. Once again, thank you to all of our donors, sponsors, and supporters. Together we can make a difference, one person, one need, one program, one project at a time. Thank you to our guest speaker, Dr. Kijana Nix. We appreciate your continued support. Thank you to Mark Crone, who's behind the scenes managing this event. Thank you to the Pan Master Steel Orchestra for providing all of the music for this event. Please stick around for 2 additional performances from them at the end of this program. Also, save the date for the KDF Caribbean Gala 2022 to be held on September 24th, which is a Saturday also. Hopefully by then we can safely go back to having this event in person. Continue to stay safe. Pan Masters will now close us out. Thank you, everybody. Thank you, everyone. Have a good evening.